In this video, I'm going to give you a good overview of all the best evidence-based treatments for Sever's disease. I'm going to split them up between treatments that help settle symptoms and ones that actually address the cause, because you do want to figure out what the cause for your child's case is so that you can stop it from coming back, really. Then we'll also look at treatments that should be avoided or are just not useful, and also what the things are that you can do once the Sever has calmed down to actually stop it from coming back. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com. We are an online physiotherapy platform where we treat all types of Achilles injuries, including Sever's disease, via video call. So if you want to know more about our service, have a look at the description of this video. You can find a link to the website there. Let's start with a quick recap of what Sever's disease is and what causes it, because I want you to have that in the back of your mind, because that will help you choose the better treatments for your child's specific case. Sever's disease is not really a disease. It's irritation of the growth plate at the back of the heel. We've got the calf muscles that attaches into the Achilles tendon, and the Achilles tendon attaches via a growth plate for kids into the heel bone, because kids have growth plates wherever bones still need to grow. As soon as we turn into adults, that growth plate fuses and becomes bone, and it no longer exists. Now, what can irritate that growth plate? Well, it's if everything becomes too tight and there's too much tugging on the growth plate, then it becomes inflamed. And it's usually down to a sudden growth spurt, so the child becomes taller quite quickly. The muscles and the nerves and things can't keep up, so they become tight and pull more on that heel and on the growth plate. And then in a combination of things that increases the pulling more, like for instance, they do a lot of sports where they run and jump a lot. Or it's not even organized sport, it's just running around in the backyard, and they love playing football. So they're playing football a lot. That can then increase the tugging and irritate it. There are other factors, like for instance, if your child overpronates, some foot postures and things that can increase it, but I'll discuss that as we go through the treatments, what you can think about when you select them. The good news is that Severs usually don't need any special treatments. It tends to react really well to a combination of just reducing activity for a little bit to allow it to recover, and then doing some exercises to help increase the flexibility of the system. Now, it is prone to recurring throughout the growing years, because every time your child grows, they are prone to getting a bit more tighter. So there are things that you can do to help prevent it from coming back, and I'll discuss those at the end. If you want to know more about what causes Sever's disease and other factors that can influence it, have a look at the description of this video. Ali and I have made quite a few videos where we go into detail on certain topics about it, and I'll put links to those there. I'm going to kick the treatment section off with treatments that can help the pain and inflammation settle down. So it's treating the symptoms, but not the cause quite yet. Why do we bother with treating symptoms? I mean, it makes more sense to treat the cause. Well, if you don't get the inflammation to settle down and the pain to calm down, you can't really get on with the exercise and things you need to be doing to fix the cause. So the number one thing that all children need to do, doesn't matter what your actual cause was, is relative rest. Relative rest is different from complete rest. Complete rest means you just don't do anything, and usually leads to quite a bit of an annoyed child because they're getting bored as well. With relative rest, you just figure out what are the things that's really pushing this Achilles and the pain levels to a level that's too much, too high, and doesn't help recovery. And you reduce those. And often there are simple things that you can adapt. And I'll talk about shoes in a minute as well, because sometimes just choosing the right shoes means that your child can run a lot more before their Achilles starts to complain. So the important thing to understand here is that it's okay for them to have a bit of discomfort while they're doing sport. And usually afterwards is when they feel most of it. But what we don't want is we don't want them to do activities to the point where they actually have to stop everything because it's now so painful, and they have to hobble. They can't even walk normal after they've done a session. That's too much. That means it's not really going to calm down. It's just going to get progressively more uncomfortable. So the level of discomfort we're looking for is, it's okay if they are aware of discomfort while they're doing the sport, and they're going to have a bit, that's expected. And it's okay if they feel a bit more afterwards. But whatever extra irritation they've caused should really be calming down within the next few hours after they've done the sport. It's okay if they need a bit of ice to help it calm down, but it shouldn't be that they're now really struggling for the rest of the day after that. So that's what you've got to keep in mind when you think about how can you get them to do relative rest. And this is one of the things that our team spend a lot of time in that first session unpacking. How much sport are they actually doing? What are the priorities? Because often the children who get Sever's disease are the ones who are really active. And you'll often find that, oh, they're not just playing football for the school team, they're also playing for Province and for another team in the town as well. So they're playing high level football for 3 teams with competitions for all 3 in 1 week. So that's a bit too much. So we'll typically then get them to say, okay, what are the most important matches that you really have to take part in? What are the most important training events you have to take part in? And then also in those training events, what bits do you really have to do and what bits can you just reduce a little bit? So this is where a conversation with the coach can be really useful as well, because it may be that they can do a lot of stuff. They can take part in some of the technique things. They can take part in the general fitness stuff. It's just the high level sprinting, or if there's stuff that's really involving their Achilles that needs to be cut out for a little bit, that they sit out or just don't do that much of. Also, if they're playing matches, perhaps it's a better idea that they don't play the whole match, that they go in at halftime and play the last half. The reason it's better to play the last half than the first half is it's very difficult to convince someone to come off the pitch when they are already playing. And if you go in at halftime, then first, everybody else is tired, and you don't have the choice to carry on further than when the match stops. So that can be a good hack as well. The goal with relative rest is that we need to calm the pain and the symptoms down to a point where the child can walk around without having to limp and without feeling much discomfort. They will likely still feel some discomfort at that point while they're running, but that's okay. As soon as they are really comfortable walking around, it doesn't have to be pain-free totally, but just not high levels, then it means that we can really start with the types of rehab and stretches and things that actually is going to make the biggest difference. So we need to get the pain under control that we can actually then get onto the treatments that's going to fix this and get them back to full sport. So all the ways that you can think about relative rest is, first of all, pick the most important bits out of the week, that they don't do the full volume of sport. Speak to the coach and get them on board so that they can help provide advice within the session for what the child does. Maybe they can do their rehab exercises in times that the other kids do other things, but that they stay part of the team, just not doing the full training. If we're talking about a dancer, then they need to be avoiding the hopping and jumping actions for a little bit. So it can be useful to mark moves out rather than do the full dance, for instance. Also, don't forget about non-sporting activities, because there's no use in avoiding all the fun things you want to be doing in sport, and then when they get back home, they're doing lots of running around in the backyard and playing matches in the backyards with friends. Sometimes, if they are doing lots of matches at school plus playing in the backyard and things, just cutting the backyard bit out can already make a big difference. The second most important treatment, in my opinion, for getting the pain to calm down quickly is selecting good shoes for your child and getting them to wear those and avoid being barefoot and in flat shoes as much as they can. Because the right shoes can make it so much more comfortable to walk around and even play sports, to be honest. Now, what are you looking for in a shoe? You're looking for a shoe that has a slightly higher heel than toes. And the reason for that is, if you think of when you stand with your foot flat on the floor, there's quite a bit of pull of the Achilles tendon on the heel bone. Now, normally that's not an issue, but if it's irritated, then that can irritate it even more. And as you walk, there will be more and less pulling depending on the cycle of the walking action. Now, if you can put your foot in a shoe where the heel is slightly higher, you're reducing how much the Achilles tendon pulls on the heel. And that's why it becomes more comfortable. So what we tend to say to children is, find a pair of shoes where your heel is higher than your toes and wear that whenever you're going to spend time on your feet. So when you've got to walk a lot, to school maybe, you may have to ask the school to allow them to wear their running shoes for a while to school. Definitely during sports. But especially for that whole period while you're still trying to calm the pain down, it's a good idea to use that. Now, sometimes the shoe alone is not enough. And if that's the case, then getting some heel lifting inserts can be really useful to just add into the shoes, but you want to add them into both to get the heel that's slightly bit higher. You can also get pronation control orthotics. If the child overpronates, that's going to increase the tugging of the tendon on the inner side of the heel. And that can make things worse as well. So if for children who overpronates, getting a insole that has a bit of arch support can be really useful. We've made detailed videos about shoes as well as insoles and the different types and which child may benefit from each. So I'm not going to discuss that in more detail in this video, but have a look. I've put links to those in the description of this video if you want to know more about that. You can use tape to help reduce symptoms for severs, both kinesiology taping techniques as well as a more rigid technique that controls the arch if the kid overpronates has been shown to be useful. In my opinion, tape tends to work for some kids, doesn't really work for others. The rigid tape that controls the arch support is a bit faffy to apply, and you really need a physio or a trainer to put it on. You can't do it yourself. The kinesiology tape is much easier to apply. I would say if your child overpronates, it's a cheaper option usually to go for getting some arch control orthotics just off the shelf ones. Remember, I've made a video about that. Than trying to tape it all the time, because the tape is also not cheap. The kinesiology tape is much easier to apply. I will make a video about that still. And if you're watching this after the release, a few weeks after, you may find the link to that video in the description of this one. If I have to summarize my advice about taping is use it if you like. It's not one of the things that I value too much for Sever's disease. If you've watched any of our videos about Achilles tendonitis or tendinopathy, you would have heard us say that anti-inflammatory medication isn't useful for those. Sever's disease is a different type of injury. Here we actually do have excessive inflammation that can be part of the injury process. So for Sever's disease, anti-inflammatory medication can be useful, but it's not that great to just take medication on a routine basis, even though it's something that you can get over the counter. I would always say, see if you can get the pain and inflammation to calm down naturally first through using the right shoes, relative rest, maybe applying ice because it's not as aggressive as anti-inflammatory medication. I'll talk about that in a minute. And if that doesn't work and the pain is excessive, then speak to your doctor. Maybe anti-inflammatory medication may be useful. If your child is finding that they are in excessive discomfort and pain after each sporting session, then that is not useful. You can't just use anti-inflammatories to calm that down and continue at that level. The condition will progress and it will become more and more painful over time. They have to adjust their exercise and their workload on that tendon that it actually doesn't push it that high into pain. So my advice on this is, yes, anti-inflammatories can be useful for severs, but use it within reason and really look at relative rest and the other elements of treatment that you calm the pain down naturally rather than having to resort to anti-inflammatories. We tend to advise kids to rather use ice than anti-inflammatories because it doesn't have that systemic effect and it's quite short-lived, and often they just need a short ice session after a sporting session to get it to calm down if the sport was pitched at the correct level. You can use ice bags for this or ice packs, but you can also just use frozen peas. If you're going to use frozen peas, just make sure that you don't actually eat them at any point because they go off if you defrost them too often. Also, if you're using frozen peas or ice directly, wrap it in a wet towel because otherwise you can get ice burns on the skin. You only want to apply ice for 10 minutes at a time maximum, 7 to 10 minutes, depending on what the child can comfortably endure. It shouldn't cause pain or be painful while they're icing. Put the ice on for 10 minutes, remove it for 10 minutes, and then they can reapply it for 10 minutes. So it's a half an hour session in total, and that's it. You don't want to sit with the foot for hours on the ice. That's not useful, and it can actually have the opposite effect. It can be counterproductive. The last treatment to talk about under things that can help symptoms settle down are orthopedic boots. Now, orthopedic boots can be useful in very severe cases that just doesn't want to calm down, but they should only be worn for a short period of time with kids and only in cases that really needs them. In our experience, kids don't really need orthopedic boots if they wear the correct shoes and manage their sport load really well. Within a few weeks, the pain usually settles down to a level that's comfortable. So orthopedic boots can be avoided in most cases, but some extreme cases may benefit from them. Now we get to treatments that actually address the cause. And the first thing I want to talk about are stretching exercises. Now, if you're thinking immediately calf stretches because the calf is tight, they actually have to be delayed until much later in the treatment process. Because if you think about it, if that heel is now super irritated, if you're going to go and do strong calf stretches, it's just going to pull on it more and make it more irritated. So the calf stretches have to be left until the heel has calmed down quite a bit. You want to think about the whole system through the body, because usually when they go through a growth spurt, it's not just the lower leg, it's the whole body that's growing, all the bones are growing, and everything is getting tight. And the muscles are all connected to each other. So while you're waiting for that heel to calm down, you can't do calf stretches, the kid can do hamstring stretches, which is the back of the thigh. They can do glute stretches. They can do general upper body stretches as well to get that mobility through it. But they also have to think about their nerves, because remember, our nervous system, our brains go into our spinal cords that runs through our trunk, and then there are nerves that come off those into the tips of our toes and the tips of our fingers. And I used to think a nerve is a really fine electrical thing that you can hardly see. But in reality, when I studied physios, I realized that no, nerves are really thick and strong structures. Your sciatic nerve, they say, is as big as your thumb in the back of your leg. So they also get tight when the bones grow so suddenly because they're soft tissue. They need time to extend. So there are exercises and stretches and mobility things that the kid can do to help those nerves slide better as well, because it can be part of the problem if they're tugging rather than sliding. Now, stretches are such an important part of Sever's disease treatment that Alison has made a very detailed video where she discusses the types of stretches, including the neural mobilization, and when you want to think about introducing all of them and getting into calf stretches as well. So if you want to know more about stretching exercises, have a look at the description. You'll find a link to that video there. Other types of rehab exercises that can be included in the rehab plan are things that improve strength and control. Now, not every child will need it. It depends on the child really. But often when a kid goes through a growth spurt, you may notice that suddenly when they run, they look a little bit like a baby giraffe. Things just don't look coordinated. And that's because now suddenly the brain was used to legs this long and now they're this long, and it needs to figure out how to use it. And also the muscles haven't adapted their strength and their length properly to control that longer lever. So it can be quite funny to look at a child and go, what's going on here? If you see them looking uncoordinated when a week ago they were really coordinated during their sport, they are likely going through a growth spurt. So the exercises that you can include here are things like balancing exercises, calf strengthening exercises, exercises that strengthen the feet and the foot muscles specifically, and also hip strength. But like I said, not all kids will need this, and the physio can determine what they actually need by observing them move. So typically for our online patients, we'll demonstrate some movements to the kid, like a single leg squat or just getting them to balance, and then they'll do it so that we can observe what is needed there, and then we'll pick the exercises that they need really. Because let's face it, it is a bit of a nightmare to get a child to do exercises because it's boring. Some kids, you may be lucky that you have a kid who is really diligent, but most kids do not fall into that category. They like running around and kicking a ball. They do not like doing boring rehab exercises. So it's important not to just throw all exercises at them that they could do, but pick the most important things so that we know that they are getting them done. And these exercises can also be included in their sporting sessions. So when they do have to sit out for something, they have something that they can do, and they feel that they're taking part and they're doing something actively to get better. So it's a nice conversation to have with the coaches again, or print out their exercises even and give it to the coach that they can know what the child should be doing. Now we get to treatments that should be avoided or that doesn't really work. The first is ankle braces. So we're talking about these typical braces that you would wear when you sprain your ankle. They are brilliant for ankle sprains, but they're not really useful for Sever's disease, because what they do is they control how much your foot turn in and out, but they keep it in that dorsiflex position, and it doesn't do anything for reducing the strain on the Achilles tendon. And often they can even press directly on the tendon and make the pain worse. So ankle braces is not something we ever prescribe for Sever's disease. It's much more useful to find the correct shoes with the correct inserts and use that. Something that should definitely be avoided is corticosteroids. Corticosteroids like cortisone injections or tablets are very good at calming inflammation and pain down. But the problem is that they do it so well that it may actually interfere with the actual healing process and the long-term recovery. So, especially for children, corticosteroids should only be used in cases where it's extremely needed. So, allergic reactions, asthma, stuff like that where it's life-threatening. For all other injuries, especially musculoskeletal injuries, corticosteroids do not have a role to play really. There may be extreme cases, but in the majority, no. It is more important to get the pain and symptoms under control through the measures that I've just discussed. Savers have a really nasty way of coming back quite frequently throughout the growing years, because your child's going to grow. But you can prevent it through taking certain steps. And the first is to actually observe when your child grows, because it's when they're in the growth spurt that they're going to be most vulnerable to developing severs. And so if you watching them do sport and you think they're not looking as coordinated or as free when they move, or you notice that they suddenly have shot up, or somebody else comments on that who haven't seen them for a while, that's the time to really just double check how is their flexibility, what's the sporting volume like, and should it be adjusted? Usually the physio you consult would have given them some stretches to continue doing or ways to check their flexibility. So if you think they've gone through a growth spurt, just make sure, check what their flexibility looks like, and make sure that they're really diligent with their stretches during that period and the other exercises they've been given. The second thing to look at is training volume and intensity, because remember, it's an overuse injury. So especially when they first have recovered from Sever's disease, if they go into full sport too quickly, it can overwhelm their Achilles again because it hasn't had time to adapt to that again. So for training volume, if you think how many hours of sport or how much running the child did last week, a good rule of thumb is not to increase the volume by more than 10% week on week. And for intensity, we're talking about how hard they're playing in a session, how fast they are running. You want to get a mix of about 20% really intense or high level activity versus 80% more moderate activity in a week. That's usually a good combination of low impact versus high impact to help the Achilles recover properly in a week. So definitely when they first come back after recovery, it's important to look at those things. But overall, also, if you notice that your child's getting frequent flare-ups of severs, even when they're not going through obvious growth spurts, it may mean that their general volume is just too much, because in general, growth plates are less robust than the bones once they've fused, or the tendons also once those growth plates have fused. So they are a bit more easier to irritate. And if your child has experienced frequent flare-ups of severs, regardless of whether they grow or not, it may indicate that actually just the volume of sport they are doing and the intensity they're doing in a week is too much on a regular basis. And you may then have to adapt things on a more permanent basis as well. But again, your physio can help you figure that out if you're struggling. Other things that's unrelated to training and growing is just thinking about your child's general health. Do they have good sleeping habits? Or are they playing video games until really late at night? Are they eating enough? Are they getting enough recovery days? Do they have some days where there's no pressure on them, that they can just do whatever they want to do. Those things can be really important for recovery. There's also some discussions in sports injury circles about whether it's maybe better to not get a child to specialize too much in one specific sport too early on, but rather do a variety of things that stress their body in different ways. Because if you do a very specialized sport really early on, you're always training the same areas and they never get time to recover. Whereas if you mix it up, that they do some running intensive sports versus climbing things or perhaps swimming in there as well, it means that you are actually distributing the load and you're developing all the systems that you get a very nice and balanced body. So that's something to think about. Then think about warm-ups. Are they incorporating enough stretching and dynamic warm-ups in their program? We've got some content on that as well that I linked to. And then thinking about the surfaces they train on. If they are prone to getting severs, then avoiding really hard surfaces, but playing on softer surfaces like grass or sprung floors can be better. Avoid worn out shoes. If the shoes look as if they don't fit properly, or they've had them for a really long time and you can see them starting to change shape, they probably need replacing. And also, if they do have to do a barefoot sport and they're finding that challenging, then perhaps they can do the warm-ups or parts of the training at least in their trainers so that they don't have to be barefoot all the time. So see what elements really affect your child's situation and how they can adapt them without it becoming a big thing hanging over their head all the time. Brilliant. Hope you found that useful. If you've got any questions, just ask them in the comments. If you need more information about specific topics, have a look in the description. I've put the video links there. And if you need more help with your child's Sever's disease or heel pain or any other injury, you're welcome to consult the team via video call. The link to the website is in the description of this video. Take care.